Or calling, geez. Uh, Hello, it's Dr. Chris Lauria from Disc Centers of America in Roanoke, Virginia. Good to be back. Glad it's a beautiful day out today. We're starting to get some decent weather after a pretty rough winter, cold and icy. I know we all didn't like that at all, but it's nice to be on the other end of that now. So uh, it's also good to be back on these live streams again, and we'll be doing regular ones now. I came up with another question, and I get it a lot. A lot of patients come to me with our treatment protocols for back pain and sciatica and those type of things that have had back surgery. And if they're coming to me, it's failed back surgery. Unfortunately, statistics aren't great for the success ratio of having a positive back surgery outcome. It's a very difficult area to work with. There's lots of nerves, there's lots of vertebrae, there's lots of discs, there's lots of things that can cause the ability of that surgery to be successful to work against that. So unfortunately, I get a lot of people who've had back surgery and they're saying, can you help me? Is there any of your treatment protocols that can help me? And it depends, quite honestly, on a number of different things, which we'll discuss today. And then there's a number of different treatment protocols that we can use to help people, depending on those number of things that they're dealing with. The first thing we got to look at with back surgeries, question one is, did your surgery include any kind of metal rod, screws, plates in your spine? If that's the situation, then there's certain protocols that we cannot safely treat you with to help you with, and that specifically is spinal decompression treatment. That's the number one indicator for someone not being a candidate for spinal decompression, and that's that they have some kind of metal in their spine. But that's not saying that we can't help those people. There's class 4 laser treatment that can help those people. There's a treatment protocol called vasopneumatic therapy, and that's a series of cups that drives electrical energy into the tissue, which can help with the pain, the inflammation, irritation, uh, uh, create muscle balance, reduce muscle spasm. It can pump swelling and edema out of tissue. Amazing new protocol that we use in our office. And I'll put a video on about vasopneumatic therapy next week. And we combine that with laser treatment too, to help people who've had that reconstructive hardware type surgery. Again, if you're considering that, once you get that done, there's not a lot that can be done after that. Even on the surgical realm, there's not many things that begin to help you with that type of thing. But we do have some protocols that can get people relief and get some of their quality of life back at some level, depending on the examination and review of a CT scan, or maybe if they can get an MRI after that, just to see what the condition of their spine is. The second type of surgeries that people get are laminectomies and discectomies. A laminectomy is they'll remove a piece of bone around the disc problem, which allows the disc to fall off the nerve, or it's not affecting the nerve because it falls into this area. Now, if people have laminectomies and discectomies when they actually go in and snip the bulge off or the herniation. Now, if people have those type of treatments, you'll still be a candidate for spinal decompression therapy, but we need to do a complete examination, and probably, if you haven't had one, a new MRI of your back to look at the state of the spine at that point and see what those levels are like, and how much degeneration is formed in the area around the laminectomy and the areas above and below it too. Same thing with the discectomy, new MRI, new exam, new nerve testing, and those type of things. So those type of treatment people, we can still do spinal decompression therapy, which is a treatment to reduce degenerative bulging, ruptured and herniated disc. And then we can use the vasopneumatic therapy around those people. And then also the class 4 laser treatment can be effective. So there are treatment protocols in our office if you have had a surgery on your back and you're just not doing well with it. You're still dealing with the original symptoms. I've had people come in and say that they're worse since the surgery, or it didn't touch it at all, or maybe they did improve for a short while and then they've gotten worse. Another key thing we need to see once you have surgery is something called scar tissue will form. And if there's scar tissue at the root of your problem, pinching a nerve, there's really not a lot we can do for scar tissue either. with any of the treatment protocols we do. So the scar tissue would be a big thing. A lot of times the only way to get relief from that is to go in and get a clean out type surgery where they remove the scar tissue. So anyway, hopefully that answers those questions for people. Again, don't get discouraged. If you decided to do surgery and you thought that was your best option, you did what you thought was best, but sometimes, more times than not, they don't work for people. But there are options, non-surgical options, non-medication options, non-cortisone or steroid injection options in our office that can help you. So what you need to do then to determine that is call our office, and you can schedule a complimentary consultation, and that'll allow us to, do a complete workup of your spine. Look at the condition of it now. If you haven't had new radiology done as far as an MRI, CT scan, or X-rays, we'll order that, and we'll let you know whether or not any of these options are something that can help you. So just call our office. If you have any questions, you can also email me at drchris@lifestyle-chiro.com. Or you can call our office and just ask for a phone consultation with me. If you don't want to take the step to come into the office first, we can discuss some things over the phone to see if if any of these treatments are an option or you're immediately not a candidate. So again, hopefully this answered those questions. I get that question a lot. We get these patients a lot. So that'll help you have some clarity about the type of surgery that was done and what your options are at this point, if it didn't help. Again, it's great to see you. Look for that video this week on vasopneumatic therapy. I am Dr. Chris Lauria from Disc Centers of America in Roanoke. Hope you have a great weekend. Enjoy this day. Thank you.